Now we'll complete the types of synovial joint. The biaxial joint. The biaxial joint is the joint have two axes. There are three types in the biaxial joint: condyloid joint, ellipsoid joint, and saddle joint. First, we'll discuss the condyloid joint. It's biaxial joint. Example: metacarpophalangeal joint or metatarsophalangeal joint. This is the example: metatarsophalangeal joint and metacarpophalangeal joint and metatarsophalangeal joint. Here, this is example for the condyloid joint. This allow movement, flexion, extension, abduction, adduction, and minimal degree of rotation. Now the ellipsoid joint, it is also biaxial joint. Okay, it is for example, this is the wrist joint. Okay, we have elliptical biconcave surface articulate with elliptical biconvex one. Again, ellipsoid joint. Okay, we have two surface, one elliptical concave and the second elliptical convex. The movement here in the ellipsoid joint like the condyloid joint, except no rotation allowed. The clear example for this ellipsoid joint, we have the wrist joint here and also atlanto-occipital joint. Now, next in the biaxial joint, the saddle joint. Also, there is concave with convex. There is concave convex in one bone with the reverse convexo-concave in the other bone. It is like the saddle on the horseback. Okay. The movement occur here around two axes: flexion, extension, abduction, adduction, and rotation. Example: it is here in our thumb. It's called carpometacarpal joint of the thumb. This is the saddle joint. The best example: carpometacarpal joint of the thumb. Now the polyaxial joint. It is the fourth type of the synovial joint called polyaxial or ball and socket. Polyaxial because it have more than two axes. Ball and socket because there is ball in one end and fit in a socket in the other end of the ball. The polyaxial joint, the movements are free in all directions and we have more than two axes. The best example, the shoulder joint and the hip joint. The movement allow flexion, extension, abduction, adduction, and median rotation, lateral rotation, and the sum of all previous movement called circumduction. Now, what about the joint stability? What make the joint stable for the movement? The joint stability depends on, first, the shape of the bone, the size, the arrangement of the articular surface. Also, the ligament must be ligament, as we see, to support the joint. Also, the tone of the muscle around the joint. There is muscle around the joint, protects the joint by its tone. The nerve supply of the joint. The capsule and the ligament have abundant nerve supply according to Hilton law. The motor nerve to a muscle gives branch to the joint, which acts the muscle, and another branch to the skin over the joint. Here are some questions. Enumerate the type of joint. Mention example of polyaxial joint. The saddle joint is present in which of the following is a pivot joint movement? Which of the following is a character of the secondary cartilaginous joint. Thanks.